Education, Labor, and Pensions will please come to order. This morning we're holding a hearing on the nomination of Dr. Scott Gottlieb to be the next Commissioner of Food and Drugs. Senator Murray and I will each have an opening statement, then we'll introduce Dr. Gottlieb. After his testimony, senators will each have 2 rounds of 5-minute questions if they wish to. Last year, the most important legislation that Congress enacted was the 21st Century Cures law. Those aren't my words, they are Majority Leader McConnell's words. The reason it was such an important bill is that it will drive forward research and the extraordinary medical miracles that are in the works and that have the potential to affect every American family. Dr. Francis Collins at the National Institutes of Health has talked about some of the discoveries that he predicts that are possible in the next decade. Non-addictive painkillers, hearts rebuilt from our own stem cells, a universal flu vaccine, an HIV/AIDS vaccine, an artificial pancreas for diabetes patients who've spent decades injecting themselves with insulin. The key to making these miracles a reality is not just investment in research, but a regulatory process that is efficient and effective enough to bring safe discoveries to patients in a timely way. The Food and Drug Administration has always been important, but there's never been a more important time to capitalize on the significant funding Congress has given to medical research and realize the promise of 21st century cures. Dr. Gottlieb, congratulations to you on your nomination. Welcome to you and to your family members who are here. I hope you'll introduce them at the appropriate time. We've enjoyed having the opportunity to visit with you in my office. If confirmed to lead the Food and Drug Administration as its commissioner, you'll be in charge of steering the agency responsible for assuring the safety and effectiveness of our nation's medical products and protecting our country's food supply. And my hope is you will help move the agency forward so that America's patients benefit from the remarkable discoveries our nation's researchers are working on. The FDA affects nearly every single American. It regulates 1/4 of all consumer spending in the United States, over $4 trillion annually. It's responsible for prescription drugs for humans and animals, medical devices, biologics, dietary supplements, cosmetics, over-the-counter medications, food, and tobacco products. It's a vital mission, and we all want to make sure the right person is leading it. The President has nominated you to do that job, and like every full-time nominee, you've been through an exhaustive process to make sure you don't have conflicts of interest or other problems in your background. The President announced your nomination on March 10 after an extensive vetting process by the White House and the FBI. Your official nomination was received on March 27 by the Senate. 8 days ago, on March 28th, this committee received a letter from the Office of Government Ethics, which carefully reviewed your financial information and found that with several recusals, which you've committed to do, you are, quote, in compliance with applicable laws and regulations governing conflicts of interest, unquote. In accordance with our committee rules, you've submitted your committee paperwork to senators on March 31, 5 days before this hearing. You've offered to meet with every senator on the committee. You've met with every Democratic member and all but 2 Republicans, and that brings us to today. You come here with impressive qualifications. You were a practicing physician and a hospitalist for many years, receiving your medical degree at Mount Sinai and your residency at Mount Sinai Hospital. We'll hear more from Senator Murphy about your other credentials, so there's no need for me to repeat them at this time, including those in the Health and Human Services and your time as a resident fellow at the American Enterprise Institute. You're a prolific writer and speaker, no stranger to testifying to Congress. You've testified here 18 times on a variety of issues. You're a cancer survivor. You know firsthand how medical treatments affect patients and their families. I'm eager to hear your views today on both the user fee reauthorizations and 21st century cures. Your first order of business will be to work with us on the reauthorization of the user fee agreements. We've had over 15 bipartisan briefings on the user fees going back to late 2015. Senator Murray and I have held 2 bipartisan hearings on the reauthorization, our second one yesterday. I support quickly moving the reauthorization recommendations to us sent in January, and I'm committed to working with the administration and all members of the committee to authorize the user fees before August the 1st. In addition to drugs and medical devices, you're responsible for protecting our nation's food supply, working to reduce the number of people who get sick from foodborne illnesses. Technology is improving and changing the way we improve food safety. It holds the potential to reduce foodborne illnesses and deaths. FDA is a large and diverse organization that faces management challenges. When I asked Dr. Califf, your predecessor, his top priority while we were working on 21st century cures, he said it was to give the FDA the authority to hire and to pay people to do what the agency needs to do. We included that authority in 21st century cures. I'm concerned, as are other members of this committee, about the administration's hiring freeze and how it will affect the FDA and how you plan to deal with that if confirmed. Thank you for being here. I look forward to hearing your testimony on these important issues, Senator Murray.